So thank you everyone for coming today. I'm happy to welcome you to today's event. My name is Professor Laura Smith. I'm the director of the African Studies program here at Georgetown School of Foreign Service. I'm delighted to welcome you to today's talk. It's part of our ongoing speaker series of the Georgetown Africa-China Initiative. Today's talk is focused on China's engagement in Africa's healthcare systems, an important and timely topic. I'd like to welcome our distinguished speakers as well as our guests to today's talk. We're delighted to host you virtually at Georgetown School of Foreign Service. This talk is hosted jointly by the African Studies Program and the Asian Studies Program, and it's co-sponsored by the Initiative for U.S.-China Dialogue on Global Issues. We thank all of our colleagues in these units for their support, and we'd like to welcome all of you to this event. All of the area studies at the SFS strive to expand knowledge and dialogue that is both empirical and gives agency to our partners. For us in African studies, this means that it's intended to enhance the stature and voice for African citizens and their place within the international system. The Africa-China Initiative is a significant opportunity to further that by advancing all of our understanding of how citizens across Africa and across China see evolving political, economic, and cultural ties and the impact of this on other strategic partnerships. So today's talk, I'm really grateful to my colleagues on this panel to focus on the critical topic of healthcare systems because it really fits so well within this. I want to thank my colleague, Dr. Yoon Park, who's helped to convene these really expert speakers on this topic. And thank again all of you for joining us. Thank our sponsors. Dr. Park will introduce our speakers and moderate a discussion for us today. Thank you.
Thank you. Thank you, Professor Smith. A recent Quartz Africa article stated that some of the deadliest diseases in Africa can be controlled by early detection, but with underfunding and a lack of infrastructure, many struggle to access even basic health care. Now, this Quartz article, which came out about a week ago, was about African e-health startups. Our topic for the event today is about Chinese aid and Chinese investment in Africa's healthcare sector. And we'll be hearing from some of the experts about recent research and projects focused on these activities. I'm very pleased to introduce our speakers. First up will be Dr. Jennifer Bowie. She is an epidemiologist with training in clinical medicine and quantitative research. Dr. Bowie has led research initiatives on social determinants of health and global health equity. She most recently is working on promoting global health governance dialogues, gender equity and healthcare access in Asia, and global infectious disease response system strengthening. Dr. Bowie's work has been published in numerous scholarly articles and journals, and she has also testified in multiple times before the U.S. congressional committees on China's global health and pandemic response systems reform. Next up will be Dr. Ammar A. Malik. He is a senior research scientist at ADATA at our neighbor school just down the road at William and Mary, where he leads the Chinese Development Finance Program. Prior to joining ADATA, Dr. Malik was director of research at Evidence for Policy Design, a research initiative at the Harvard Kennedy School. He also worked as a senior research associate at the Urban Institute. As a former corporate banker at Standard Chartered, he has advised Pakistan's National Disaster Management Authority, the International Food Policy Research Institute, the UK's Foreign and Commonwealth Office, USAID, UNESCO, and the World Bank. And lastly, but not least at all, is Ms. Fu Mingui. She is a seasoned investment specialist with operational experience in over 15 countries. She is currently the upstream officer at the Global Manufacturing Agribusiness and Services Upstream Unit at the IFC in Washington, D.C., where she focuses on providing capital and resources for early stage project development support for South-South investment projects. Previously, she served as senior director at the Chinese Overseas Infrastructure Development and Investment Cooperation under the China Development Bank's China-Africa Development Fund. And before that, she was with the World Bank Group on investment operations and business partnerships in Africa and the US. As you can see from the long and extensive CVs, of which you've only heard a tidbit, we have plenty of expertise on the panel today. So let me go ahead and turn straight over to Dr. Bui.
Well, thank you, Yoon, and thanks to Professor Smith for inviting me here. I have always been a fan of Yoon's work, especially for the Africa to China and Chinese in Africa network. I know there are lots of expertise here, so I would just like to kick off with some historical view of the China's health program in Africa to start the discussion. I'm looking forward to for our discussions. Let me try to share my screen now. All right, so what I will try to capture as a beginning of the discussion is China's health assistant in Africa from a historical perspective. As Yoon said, I've been teaching at Georgetown on global health for about 17 years, but my work on this topic is mainly funded by the RAND Corporation, where I serve as a town chair for China policy. All right, I only have 2 slides here, so this is a very, very busy slide. So this is really my overview of what I see as China's activities in health activities in Africa. I would like to divide it into 3 different eras. So there might be, I'm still working on these ideas, concepts, so excuse if any typos you found. But in general, I thought, we should think about it as 3 different time eras. One is the Cold War era, which is range from 50s to 1980s, late 1980s. And the second one period is from the early 90s to about maybe 2010. And I like to characterize that period as more of a globalization or blossom of globalization during that time. And the third era, I would say, is from 2010 or maybe a little bit later, 2014 to present time, where we start to see increasing great power competitions. And for each of these era, I would like to look at the motivations of China's health assistance in Africa, as well as the agencies, government agencies that's working on these different priorities. And then in terms of the activity, in general, I group these activities into 5 categories, right? So the China medical team, the infrastructure building of the clinics or the hospitals, the medicine and medical devices donations or market, that's the third one, training for the healthcare professionals, or it include public health as well as clinical and research. And the last activity, I would say, is humanitarian aid. And then I would like to talk about the impact and the criticism relates to each era that dominate each one of them. So I would say that in the first era between 1950s to 80s, that's the start of the PRC, and that's when the PRC is moving from a very isolated country gradually to re-enter the global stage. And I think the healthcare in Africa actually has a big role there, because in 1963, that was the first year that China sent out a China medical team to Algeria during the Algeria War, when many of the trained professionals left the country. So at the time, the Algeria asked China's help, and that's the beginning of these activities on the record, at least. In 1963 to 65 was also the first time that the Chinese premier, Zhou Enlai, visited Africa for 3 times. And based on those trips, they're setting up the 5 principles for China's foreign affairs, and also the 8 principles for foreign aid. So I think even to this day, even though it's half centuries ago, these are still the building blocks blocks and foundations of many of the principles that China has been following for many years. So I would say the motivation at that time, that in the 60s, we see that China sending these teams to up to 8 countries in Africa, and in 70s, that expand to 28 countries in Africa. So that's the predominant form of the China's activity in those years. And the main goal is really to build a bilateral relationship and build third world collaborations and alliances. And that, I think, helped China to enter the United Nations in 1971, when most of the African countries were given the cast a favorite ticket, the votes for China. And that's where, when China started to, be more active with WHO and so on. So that's the beginning. So the impact, the team itself, I would say, is not maybe so much, because most of the medical team are pretty small, but it definitely gained China the soft power, and it's more on the political rather than the medical or health side. There were few criticism were raised at the time. And then comes the next era, which is after the 90s, after the Cold War, we say. And this time that China focused much more on the globalization and the market. And the motivation for their activities in Africa, mostly focusing on natural resources, collaborations, and the market. It's mostly market driven or protecting the investments. And this time, the agencies that in charge of many of these activities, like the building the hospitals or donating the medicine and medical device, are mainly in charge by the Ministry of Commerce. Rather than the foreign affairs. I think the foreign affairs is only still in charge of the medical teams, which is usually formed by different provinces, that each province has certain friendship countries. So that in this era, I would say the impact is limited, because it's overshadowed by many of the Western countries' large projects of health. There were some criticism maybe at times, and mainly limited to local areas, about the counterfeit of the appearance of counterfeit drugs, and some of the quality and how Chinese activities integrate with others. Now comes to the latest era, which is as we can see after 2010 or 2013, when the BRI started. So we see a lot more activities here. And the interesting part is all of these activities become more integrated. So for example, when the large hospitals was built before 2010, they're usually only, they would say, well, the medical device were donated, were integrated with that activity. But in the current era that we see, not only the hospitals were built, but there are, the Africa CDC headquarters in Ethiopia was built by China, at the time actually working with US CDC. And we also see the multi-country clinical trials for COVID-19 vaccine, as well as some of the digital cities that China built, maybe not in Africa, but at least in Southeast Asia, that integrating lots of the technology and healthcare into that. So medical teams also become much more specialized. So now they are targeting either congenital heart diseases or surgeries, or during COVID-19, there were COVID-19 treatment teams that in charge of both training as well as care. In terms of training, there also start to have regional training, say with ASEAN, and also more government scholarship to scholars from Africa. And humanitarian aid is also came up to be much larger force. With Ebola, I think China sent out a 1,200 members team, which much larger than the traditional medical team. So these are just the changes, and the agency also now we have a new agency in charge of all the global development and modeled after the USAID, right? So, and the latest statistics on the vaccine, COVID-19 vaccine to Africa, this chart is from the Bridge Beijing office who are tracing the COVID-19 vaccines. So we see that there are lots of pledges that in last year, February, about this time, they pledged to support vaccine to 19 countries in Africa. And in November, after the conference in Beijing, there's new pledges of 1 billion dosage of donations and joint productions of vaccine in Africa. And currently there are 47 countries, as noted on this map, that has been receiving Chinese vaccine. Although, overall the deliveries are still limited because of the pricing as well as the technical issues. All right, so I think with that, I will just stop my presentation here, and I'm looking forward to hear other panelists' thoughts. Okay, stop that.
Thank you so much, Jennifer, for keeping actually way below your allotted time. So that leaves us a little bit more time for questions and discussion. Let's go straight over to Amar Malik.
Thank you very much. It's a pleasure to be here, and I'm excited to share some early findings from a project that I've been involved in. We're calling it Win-Win with a question mark, China's health funding in Africa. So as you can tell, this is an exploration of the impact of Chinese development financing in Africa's healthcare system. So you should treat this as work in progress, and I'm very much looking forward to your feedback. I was hoping to cover 4 things today in today's presentation. First of all, I would like to take a few minutes to introduce aid data and the Global Chinese Development Finance data set, which I feel is a resource for all of you to explore some of the things, for example, that Professor Boye was talking about. The second part of the presentation is I'm going to try to explain some of the motivations of why I think that the data set that we've put together and what we are basing our study on helps fill a big gap in our understanding of China's role in Africa's healthcare system in the last 20 years. And the broader questions around what the China model of engagement brings to the table and how it fits with other more traditional donors' engagements in African healthcare. And then I'll share some initial findings. We're trying to break down the portfolio of Chinese engagement and compare it to OECD reporting mostly Western donors. And then I'll leave you with a few thoughts on what I think this means for global health policy, and we look forward to your feedback on this. First of all, I'd like to quickly introduce my team. As you can see, it's a big team. We are a big multidisciplinary team across 2 labs at William and Mary, including my lab at Aid Data, but also at the Center for Policy Impact in Global Health at Duke. We are health economists, spatial epidemiologists, policy people, and we are working together on this exciting project. Now, as far as Aid Data is concerned, I just wanted to give a quick overview of what we've been doing at Aid Data. So if you can see, we've been putting out a series of reports mainly focused on 2 aspects of China's overseas footprint. On the left-hand side is a series of reports on development finance, which is where I will draw most of my analysis on. Today, we've been doing this for almost 10 years, and our latest data set was released in 2021. We also do quite a bit of work on public diplomacy in China. Latest report is called Corridors of Power, which looks at soft power and how China uses its engagements in Africa and elsewhere to enhance its global influence. So I would invite you to visit our website and get into some of the details, but what you'll hear about today is an overview. So first part of my presentation, as I said, I'm going to talk a little bit about the data set that underpins some of the analysis that we will I will present today. And it is coming out of a report called Banking on the Belt and Road that we released in September of 2021. The reason why we do this work, I think it's very important to remember that unlike some of the world's large post-Second World War donors, I'm thinking of the US, the UK, France, Japan, etc. China does not systematically report its overseas development financing activities to any international body like the OECD or others. This creates an enormous gap in our understanding of the scope, scale, and impact that this financing has. So we at Data are on a mission to try to collect as much of this information as possible, both from official sources and other open sources, and try to fit it at on the same criteria that the OECD does, so that we can do apples to apples comparisons between Chinese and other countries for financing. In terms of the scope of the data set that I'm going to talk about today, we cover all official sector financial flows from China. Of course, today I'm going to talk about healthcare. We cover more than 13,000 projects with worth $840 billion in 165 countries. We capture 18 financial commitment years from 2000 to 2017, and we detail a lot of the timing of the project implementation up all the way up until 2021. So if a project was committed in 2017, chances are that it started in 2018. Because our data was completed in 2021, you'll see the status there. In terms of comprehensive coverage, we cover basically all sectors according to OECD's definitions. We cover low income, lower middle income, and upper middle income countries. And we cover all sorts of Chinese government and state-owned financial institutions, which we would call official sector institutions. So our canvas is quite broad, and it goes beyond what we would traditionally understand as being aid or technical assistance. We have, just to give you some numbers, we have over 300 official sector financing institutions from China, over 2,400 borrowing or recipient institutions, and lots of implementation institutions. This is, by the way, not just health, but all other sectors. I'll come to health in a minute. Just to give you a sense of the kinds of details you can obtain from this data set, we have for every project out of those 13,000 or so projects, we have about 70 variables. So you can go get details on the financing institutions. If it's a loan, you can get details on interest rate and maturity. You can see if the loan is collateralized, whether this is ODA or OF, and I'll come explain that in a minute, but basically whether it's aid or loans. And then we have really detailed project descriptions, about 140 words on average for a given project, which enables you to really understand the story of each and every project, because there's lots that is hidden in the qualitative information sometimes. Now, you must be wondering how we actually pull this off. So in any given year, Aid Data and the team that I'm leading, we hire more than 100 students, staff, and faculty, and we synthesize and standardize information from a huge variety of sources. Increasingly, we are relying on official sources like grant and loan agreements that are published by government registers and gazettes, but we also rely on aid and debt management information systems, on annual reports that are put out from entities in China and elsewhere. And also when we need to fill in the gaps, we use open sources, including social media and other things. Our data set, just to give you a sense of the scale of this, has over 91,000 sources. On average, a project would have 7 sources, and about 90% of our projects are backed by at least one official source. And I'm very proud to say that all of our methods, our data, and our sources is fully transparent and on our website, so you can dig in and make your own conclusions. Before I come to healthcare, I want to just contextualize the scale and scope of Chinese development financing in the last 20 years. I think it's important to understand what's happening in Africa and healthcare in this context. So what we find is that in the first 5 years of the Belt and Road era, which is the 2013 and later, China is now outspending the US on a more than 2-to-1 basis, which means that their average commitments are now touching close to $85 billion a year. On the first figure here, you can see the color of the funds. ODA, you can think of this as aid, and OOF are other official flows, which are loans, export credits, and other things. You can see that China's beating the US and others simply by the scale of their OOF or other official flows, which dwarfs the rest of the donors in the world. This means that China is basically maintaining a 9-to-1 ratio of loans to ODA or aid. And I think this is very, very significant. And it needs to be understood that a lot of Chinese activities overseas is in the form of other official flows. Now, a typical overseas loan from China, and there is a few loans in healthcare, but not a lot, but the typical overseas loan from China is at about 4.2% interest rate and a 10-year repayment period, whereas a typical loan from Germany or France has an interest rate of 1% or 1.1% and a more generous repayment period. And that's because China is more willing to go into riskier countries where the fiduciary risk is much greater. We also find that in the Belt and Road era, China is now 3 times more likely to fund mega projects of $500 million or more. And a larger proportion of Chinese loans and export credit activity is being done through syndicated loans, where big groups of Chinese and non-Chinese entities come together to give out loans. And we also find that there is a 5-fold increase in lending from Chinese state-owned commercial banks, like Bank of China and ICBC, during the Belt and Road era. So these are pretty major tectonic shifts that are taking place in overseas financing activities. Now, I was talking earlier about the lack of transparency or not having information and why we do what we do. My central argument for doing this work is that if there is lack of aid transparency, if there is lack of information and data, that leads to bad policy outcomes. You simply cannot know what's working and what's not working if you don't know where what is being spent. And this is particularly true for quintessential social and economic sectors where you sometimes don't even know what you're dealing with. So I think the result of this is that there's poor donor coordination, and there are sometimes misunderstandings on who's doing what. And as a result of that, many groups within society can miss out on the benefits of foreign aid or spending from overseas. So some of the questions that have animated this project are, what parts of the healthcare system in Africa receive greater funds, or where and when did that happen? Are Chinese engagements altruistic or opportunistic? And does participation in Belt and Road make a difference? Because some countries have opted in and others, some haven't. Just to give you an example of the kind of project detail that we are able to provide, if you go to china.adata.org, you will see all of the projects that I described listed out, and you can search through them. So this is an example of a loan that was given out to build a hospital in Africa. You can see that we have that. I'm sorry, this is so small, but you see that we have the description here. You can see exactly where it is located. It tells you the commitment amount. It gives you a timeline on where the project stands. And when you aggregate all of these data together, you start to paint a big picture. So let me just give you an overview of what we are finding in our data so far. Total commitments in healthcare in Africa, global health commitments are about $5.6 billion between 2000 and 2017. For about 1,450 projects worldwide. And the share of that in Africa is 2.7 billion for about 1,000 projects. So on average, the projects in healthcare in Africa tend to be smaller in size. Before Belt and Road started, the annual average was only about 67 projects in Africa worth $253 million worldwide, which is still a very small proportion of Chinese development finance portfolio, less than 1%. Whereas in the Belt and Road era, even though the number of health projects worldwide have increased and the total outlay has increased to about $500 million, it is still an even smaller proportion of Chinese portfolio, which is quite big. So in the grand scheme of things, my point is that health spending from China is still minuscule but the impact that it could create, I think, if spent well, is quite large. And just to give you a sense of what I was saying earlier about official development assistance with i.e. aid and other official flows, i.e. loans, most of the health portfolio that we see in our data set in China comes from China to Africa and around the world, comes in the form of aid rather than other official flows. And that's to be expected, because you don't expect, unlike a power plant or a highway which can toll, you don't expect a return always from building health infrastructure. So let me just tell you a little bit further about what we're finding. So in this chart, you can see that these are all of the Chinese health aid projects in Africa. And what we did was basically, we went into our data set and used the OECD's 5-digit classification criteria to move beyond healthcare and go into the subsectors within health. So for example, the blue color that you see here represents basic healthcare in the area of personnel. The green is basic healthcare and equipment. This darker green shade over here is malaria, and so on. So we're just trying to understand, where is Chinese money going within healthcare, and how does that compare to what other countries are doing around the world? Now, the first thing that stood out to me was that in the first few years of this century, the sheer subsectors within healthcare are quite small. So you can think of this as a more basic sort of engagement level, where a large number of projects were in basic healthcare services. And then what we saw in 2006 until about 2008, 2009, right here, is a much larger share of the money started going towards malaria control. And I think this has to do with the discovery of new treatments that were made. My friend and my colleagues in global health will confirm this, but I'm told that there was artemisinin treatment that was discovered, and China became malaria free. So this could actually be an example of how China is exporting a treatment technology to Africa and having an impact. And then the last thing I would say is that in around 2014, I suspect because of the Ebola crisis, we saw an upsurge in infectious disease spending in Africa. And I think that shows something much broader and very important, which is that Chinese entities have the tendency to be demand responsive, or they are aware of the situation and they have the ability to respond quickly. And this perception that they're somehow tone deaf doesn't really hold true if you were to look at this example. But of course, we can dig a little bit deeper into this as well. Now, just to give you an overview of what we see in the data, this is giving you a sense of the intensity of the spending, where the darker shades indicate a larger commitment value. You can see up here in the scale, and the lighter shades are lighter. And there's a couple of countries where we do not have data, so these are white. So you can see, if you look at by the commitment amounts in US dollars, countries like Angola and Kenya are getting a bulk of Chinese funding over the course of the 18 years. But if you look at it from purely the number of projects, not the amounts, but the number of projects, then you see a lot broader outlay of funds. Which tells you that if you compare even the pre-BRI era with the BRI era, you still see that certain countries are getting a lion's share of health commitment projects. And I think Angola seems to be a favorite in general of Chinese overseas development financing, generally beyond health even, likely because it's a resource-rich country. So that is bringing health investments into Angola as well. Now, how does this compare to the OECD donors? By the way, the OECD runs the Development Assistance Committee, which consists of about 29 donors, which you can consider the traditional donors. So you can think of all the G20 countries plus new entrants like South Korea. South Korea, I guess, is part of G20, but Saudi Arabia and the UAE and Qatar and Turkey and others. Here, I see a lot more stability over the years in terms of the sectoral allocation. So although I see that in around 2009, 2010, the total volume of aid going into Africa was increasing. This, by the way, is purely ODA, doesn't include OOF. The colors are pretty stable. So you don't see a lot of jumping like we saw in the China data. And just again, to give you a sense of where that money is going in Africa, you see that a lot of the money is going in Tanzania and or toward Eastern Africa, and less so in places like DRC and Angola, which seems to be favored by Chinese financing. So I can see that there are some complementarities that are naturally emerging. And I wonder if you think of the policy implications of these findings, whether there are opportunities for Chinese entities and more traditional donors to do a better job coordinating on what they're doing. And on that, I'll say a couple of things, Yoon, and then I'll stop. If I'm going over time, I apologize. But what we see is that if you look at the OECD data, we have put the lighter colors here in the bars as being the early years, so 2015 to 2018, and then the late years are 2019 until 2021. What we're seeing is that there is a greater proportion of money being allocated to basic healthcare, but on the same token, we see a smaller proportion of money going to health policy and administration. And interestingly, there is more money being spent now on basic health infrastructure, which has been China's strong suite since day one. So I think that what our analysis shows is that there is quite a different flavor between what the Chinese are financing in healthcare in Africa and what OECD countries are. And it opens all sorts of opportunities for collaboration and dialogue moving forward. I think I've already covered some of these points, but I'll just say that what we're finding in the literature, when we look at healthcare literature, we see a lot of the studies that are focused on sectors within health. So malaria-focused studies, or infectious disease-focused studies, or AIDS-focused studies, but there is not generally a whole host of studies that look at the entire healthcare system as a whole from the perspective of China's contributions. And I think we need to broaden the horizon a little bit further in order to paint a bigger picture. And I think that this is important because this is how you develop a deeper understanding of the implications that Chinese involvement in African healthcare has on access, on equity, and quality. Last thing I'm going to say is that as we take this project forward, we want to take deeper dives into the spending pattern shifts that have taken place. What kind of events have actually prompted Chinese entities to shift the way that they spend? And we will also now be doing more thematic text analysis on what I told you were like about 140-word project descriptions for 1,500 or so health projects to extract even more information out of them. And I would really love to get your reactions and reflections on what you think are the opportunities for great power collaboration. We talk about great power competition, but maybe there's opportunities for great power collaboration in this healthcare system where perhaps the Chinese advantages in healthcare infrastructure could be complemented by traditionally spending on the softer side of things like technical assistance and policies that Western and OECD donors seem to be supporting. So I'll stop here and I look forward to the discussion. Thank you very much.
Thank you so much, Amar. Our last speaker today is Mingwei Fu, who's going to be speaking on a slightly different topic in terms of project support.
All right. Good evening, good afternoon, everyone. My name is Mingwei Fu. Currently, I'm based in Frankfurt, so it's already night in my time. I'm moving back to DC in July, so hoping to meet some of you in person very soon. I'm from FC. As you know or may not know, FC is a member of the World Bank Group and is the largest global development institution focused on the private sector development in developing countries. So I'm from the FC Global Mass Upstream Unit. MAS stands for Manufacturing, Agribusiness, and Services, which covers the industries my unit is working on. It's my great pleasure to be here and to communicate with you. My presentation focuses on FC's role in China's investment in Africa in health sector. So this is the outline. Unfortunately, I don't have PhD degree and I don't do policy research or analysis. But our unit does have some first-hand experience in investing in Africa, especially on encouraging South-South investment, including supporting Chinese firms' investment in Africa which I'm currently in charge of within our team. Prior to joining FC, I worked for the early stage infrastructure development platform under China Development Bank's China Africa Development Fund. So I led the international collaboration unit to work together with international developers to generate leads in infrastructure sector in Africa. So I sort of understand both sides about the logic and the process. So before we start to talk about the IFC's approach and tools in supporting Chinese health companies in Africa, I think it's useful to have a quick look about the trade between Africa and China in health. So the data is kind of out of date. It's from China Chamber of Commerce for import and export for medicines and health products. Since currently there's no comprehensive data capturing Chinese health companies' investment in Africa, especially for those from private sector, where FC is majorly working on. So the trade data may give a screenshot about what kind of products that are commercially active in Africa and have the market in this region. So the product mix for the export from China to Africa has been consistent over the last 10 years. And also the product types are very consistent with FC's investment coverage and areas that where we can provide value addition. So for example, in 2019, 56% of export products were medicine and drugs, 41% were medical devices, and 3% were traditional Chinese medicine. So FC can't invest in traditional Chinese medicine, but we do invest a lot for medical device and life science, such as generic drugs and APIs. I will introduce more details later on. And within the medicine and the drug group, APIs accounts for 55% of the total exports, and the pharmaceutical preparation was 34%, and biochemical drugs were 11%. Given the interest of time, I'll skip this slide. So this slide is kind of, repetitive from Dr. Bowie just introduced. But as part of the major products during the pandemic, I would like to show a summary of Chinese COVID-19 vaccine to Africa. So currently, IFC is collaborating various Chinese vaccine manufacturers, such as Sinopharm, Fosun, and CanSino. For example, in 2021, we invested a total of $200 million in Fosun to promote its collaboration with the German vaccine manufacturer BioNTech to build a manufacturing plant in China. And currently, we are in close collaboration with Sinopharm, although it's an SOE, but we can't invest in SOE directly, but we sort of find a way that we can, provide matchmaking services to link Sinovac to some local manufacturers and encourage them to have local collaboration and technical transfer. Actually, before the pandemic, FC didn't invest in injectables, but COVID-19 completely changed FC's perception because FC has seen the vast gap in the availability of medical supplies, equipment, and pharmaceuticals between the developed and the developing world. So it's really necessary and quite urgent to increase first the private sector's capacity to provide key healthcare products and services required to fight the pandemic. And also in the future, going forward, we need to increase the resilience of the developing countries by diversifying the supply chains and creating regional and local manufacturing capacity for key medical products, which are currently concentrated in the few markets. So for the second topic, I'm going to introduce FC's value addition in Chinese health enterprises going out, especially in Africa. So as I mentioned, I'm from FC upstream team. this slide shows what FC upstream is. So this is closely related to the refined and involved role of FC in supporting Chinese companies in investing in Africa. So upstream was established in FC 3 years ago. It's the most important component of FC's current corporate strategy. We call it FC 3.0. So the corporate strategy is about proactively solving challenge to grow private sector in developing countries. So we are committed not just to financing projects, but also to create markets and mobilize private capital at a significant scale with greater focus on the poorest countries in the world. So in short, the upstream is about early stage project development. It's about the creation of a programmatic approach for business development and provide sector and market interventions to improve investment environment. So in the past, FC seldom involved in Chinese companies' investment in Africa. As lots of business cases needed to be strengthened or restructured, we found it was really difficult. And also, most of the Chinese private companies lacked experience on working together with multilateral development banks. So through upstream, we are very proud to see that during the past 2 years, the global upstream team was able to engage a total of 6 leading Chinese private companies in health sector to support their project development and investment in Africa, amounting to a total of $400 million US dollars investment in Africa. And currently we are developing several and more pipelines with Chinese companies in Africa to generate more investment and the development impact locally. This slide shows like how upstream fits in the whole range of FC products and services. Through the case, I'm going to introduce more like how we could convert from the upstream to investment, and then move, when they are our existing client, we could also provide advisory services to strengthen their capacity locally. And also we have the mobilization, and we could connect with MIGA. MIGA is more like international version of Standard Shore. So it could provide guarantee for Chinese companies, especially in Africa, which require a lot of which encounter a lot of political risk. So it needs insurance and guarantee for sure. So I'll quickly skip this slide. This slide show different upstream engagement model. We have advisory service, upstream project advisory, and the co-development model, and we could also find a pilot project. But I would like to bring your attention that upstream is we are commercially running this business. It's not that we provide grant to Chinese companies. Chinese companies need to have skin in the game. At least they need to provide up to 50% of the early stage funding to collaborate with us. And our business model also require us to charge success fee when we successfully develop the bankable projects for those Chinese companies. So in short, we are employing a holistic approach, combining project development support and investment for clients and partners. And in all cases, FC will be seeking a lead ranger role in the financing and an option to invest in this project, which means we will serve as a lead ranger when the project become bankable in Africa. And we would like to provide long-term financing eventually. So I will introduce some case study. I would like to point out that, currently only 8% of the medical supplies demand in Africa could meet the local requirement. That's why we need more like local production and regional production support. FC spearhead our efforts in supporting Chinese companies, which definitely had a lot of investment appetite and advantage in this area. And also, I would like to give you a snapshot of FC's investment in Africa in health sector, and not only in Africa, but overall globally. Then I'll move to Africa. So the whole portfolio for health sector is totaling to 3.2 billion US dollars in 53 countries. We have three major subsectors, including health services, life science, and medtech. For health services, we have a total of 907 million US dollars portfolio, active portfolio. We foster health system integration by bringing together delivery, management, financing, and organization of health services. A typical example is that we would like to invest, diagnostic labs, and also, for example, centers of excellence or standalone hospitals. The second sub-industry is life science, which include, supporting the development of regional pharmaceutical hubs in key developing market. Africa is, to be honest, Africa is the most important and the priority region for FC. And we also support regional generics manufacturers and the pharmaceutical retails. The total portfolio is 1.8 billion US dollars. The third category is the medical device and medtech. The total portfolio is 509 million US dollars. So for this part, we promote medical technology that are appropriate for developing market conditions. And we also support medical devices and equipment manufacturers. For example, in COVID-19, we support the PPE and garment and medical dressing manufacturers. And we also support the distributor to promote the distribution networks for local high quality medical equipment in emerging markets. So for active portfolio in Africa, currently we have 3.4 billion. And for health, we have a total of 564 million US dollars. So I would like to introduce some case. So firstly, I will start with our high profile platform, and we call the facility. We call the African Medical Equipment Facility. It's a research sharing facility among FC and the local participating financial institutions and the leading medical equipment manufacturers. We call it OEMs. The aim of the AMF is to support the acquisition and lease of medical equipment by health SMEs, such as clinics and private hospitals. So for example, the financial institutions are those local banks, such as Standard Banks and Eco Banks in South Africa, in Kenya, and in Cote d'Ivoire. The first phase of this program consists of an up to 100 million US dollars research sharing facility to support an aggregate portfolio of up to 200 million of loans and lease in a total of 8 countries in East and West Africa. And this facility is really helping the small healthcare SMEs to have access to getting financing from the local banks. So Upstream identified and engaged a group of diversified Chinese medtech OEMs through enrolling them to AMF. And this is the first step. And going forward, we will follow with developing upstream projects for encouraging local production for them. Currently, we already engaged 3 leading OEMs. One company is from China, is a leading company focusing on producing IVDs and diagnostics. And another one is a Chinese manufacturer holding the leading position in anesthesia and ventilator equipment. And the third one is the one who produce the CT and MRI scanner production. So through those onboarding these three leading OEMs, they could provide up to $30 million guarantee for local health SMEs. This is corresponding to a total of 300 million equipment sales in Africa. And the onboarding process, we have really strict requirement. For example, they need to have good reputation in the market, especially in African markets. And also they need to have already relatively large market shares, or this could guarantee they could provide really over a comprehensive services and training services for the small SMEs. And also they need to provide at least 5 million guarantee for the small SMEs in Africa. But actually, all the three Chinese companies, they provide 10 million guarantee, which is really a success for us. So for Chinese medtech manufacturers, we partner with, they partner with IMF, could definitely increase their sales opportunity and strengthen their branding as they expand their presence in a faster growing market in Africa. So in this way, they can also contribute to strengthening healthcare systems, while countries, investors, and development organizations continue efforts to build greater self-sufficiency by fostering more local production of medical products. So the second case is also a very interesting case. Is in life science area. For most of the Chinese companies we are working on, currently we are supporting their expansion to Africa to increase the local production capacity. So this one is, we are partnering with a leading ARV products manufacturer in China to help them to develop their market entry strategy in Africa. The context is about, local manufacturing of pharmaceutical products is still nascent across Africa. Over 70% of drugs are consumed, including over-the-counter and the prescription drugs, are imported. So the gap between imports and local production in sub-Saharan Africa is even more pronounced when it comes to chronic medication for the treatment of HIV and hepatitis B. So we are partnering with this leading Chinese ARV production company on developing a market entry strategy for Africa that entails assessing the commercial and technical feasibility study of building a pharmaceutical plants in select Africa country to shift their supply chain and serve the regional market. This company, it has a full value chain in China, but they're not so familiar with the market in Africa. And they're really keen to find a local partner to bring them up to speed about the Africa environment. So we divide this support into 3 phases. First phase is that since they are not quite understanding local African market, and they are not sure which market they should locate. So we collaborate with FCE team to conduct the research and identify a parameter based on the Chinese company's product portfolio to narrow down a total of 6 countries in Africa for them to locate as a potential location. Then we move to phase 2. We help them to identify local partners. We narrow down a total of 40 local partners, and based on the selection criteria provided by the Chinese company, we sort of providing matchmaking services and identify a total of 5 local winners of the local partner as the local partners with this Chinese company. Then we facilitate their negotiation and discussion. This is where we are right now. So for phase 3, we are going to co-fund the feasibility study for the local partner and the Chinese company for them to set up the manufacturing plant for generic drugs and APIs. The last case is a really huge investment. The total investment size is 150 million. Currently, this project already moved to investment stage. So we hope we could disperse the loan in June or in July. So we are developing this project with a Chinese medical company. The company is a public listed company and the second largest medical dressing manufacturer in China. So overall, the company has a really strong balance sheet and a very strong operational capacity to manage very complex investment in China. However, they are not very familiar with Africa. It was the first time for them to invest in Africa, and this creates space for FC upstream intervention. So the project is about establishing a greenfield factory in one Eastern Africa country for manufacturing a wide range of products, including medical gowns, syringe, and PPEs. The sponsor has strong commitment to investing in Africa. Even before the pandemic, they already started research, but it progressed very slowly. So ever since FC joined their activity, it has been progressing very quickly. So therefore, FC's upstream role in this project is mainly to fill in the gaps of making the project's investment ready for FC. According to their request, so we are helping them to prepare the feasibility study and help them to investigate the legal and regulatory environment. For this part, it's really interesting. For legal and regulatory environment, we got funding from FCDO from the UK to provide a grant. As I just mentioned that although we run the whole business commercially, but we do provide some grants, especially for those products in critical needs, for example, for PPEs in Africa. So this fits the case very well. That's why we could provide a total of $40,000 grant from the UK to the Chinese company. I could see it's also an excellent case that we promote multilateral collaboration and promote the collaboration between Chinese company and the aid agency from OECD countries. And also we work closely with investment team and IDA PSW to provide preferred interest rate for local financing loan. And also we collaborate with its MEGA team to provide guarantee and help them to structure the bankability. So I'll stop here. Maybe when you have questions for details, I could share more. The last portion, I will quickly go through it. Is other FC
Sorry,
tools
Mingwei, can I cut you off? Because
okay,
we're already
sure.
way over time.
Sure.
And I want to make sure we have some time for questions and
no
discussion.
problem. Yeah, it's
Thank
just
you.
PPP and digitalization and matchmaking services. Okay,
Thank you so
I'll
much.
stop here.
Okay.
Thank you.
I want to say thank you to all of our speakers for their presentations. I think starting with Jennifer's historical overview of health assistance in Africa to Amar's kind of very thorough explanation of Chinese financing and assistance in the healthcare sector, to Mingwei's discussion of IFC support for Chinese private sector engagement and the health sector. There's clearly quite a lot going on. Before I go to the Q&A, I thought I would turn it back to our speakers and see if they have any questions for one another. I know that we've got some broad questions that I'll get to, and Jennifer's been great about answering some of them directly in the chat, but I think we might have others who want to respond. So I'll read out some of those questions in a moment, but maybe if we can just go back in the order that we started and give you an opportunity to engage one another, because I'm guessing that this might be the first time that you've heard some of the kind of information that's coming out, particularly about the private sector engagement. So Jennifer.
Yeah, so first of all, I really appreciate the two panelists, a really wonderful presentation. Emma, I know I used AIDS data before. We actually published with Tsinghua University on one of the looking at the health. So this is truly one of the few treasure for in terms of data. And some of your data, one of your slides showing that 2000, especially you showed up at 2006 to 2012, there was an increase of anti-malaria. So I think that's also noted in, at least one of my congressional testimony that qualitatively, we did see reports showing that that's the time when China really offered that the Nobel Prize winning medicine to Africa, but then it stopped. The reason for the stop is for some of the counterfeit issue, medicine issue. And then the same thing, your analysis, your hypothesis about 2014, I think it's also right on target, which is 2014 to 16, that's the Ebola support. So I'm really amazed by, in a way, I think we confirm each other's mind. It's more from a quality by talking to Chinese agencies and experts there to get this sense, but then confirmed by your data, it sounds really wonderful. And for Minghui, I think my question is, again, it's really great data to see that the private companies' interest in Africa. How does it work with the BRI? Does private companies also, many of the BRI projects are initiated by the SOEs, the large government-backed funding, as well as the companies. And so my question is really, how do you see that the similar interest from the government and SOEs?
And let Minghui answer the question.
Thank you, Amar. Thanks, Dr. Bowie. So I would say, from my previous job, I mean, when I was in China, I worked a lot with SOE, especially in infrastructure projects, and also, with those EPC. I feel like they are totally excluded by FC, this kind of development organization, which only support the private sector. So yeah, and also I confirmed my perception when I joined FC, because FC really focus on developing private sector. And FC think the private sector would be the most important role, not only in their own country, but also in South-South investment and also in BRI. And to be honest, I feel for SOE, it has different, especially Chinese SOE, it has different decision-making process. So sometimes it may be not so commercially oriented. So that's why sometimes the FC shy away from those SOEs. This is my observation. But as I mentioned that there was a case that we collaborated with Sinopharma, because although it's an SOE, but it opened a lot of doors for FC, especially it helps us to gain more access to local partners. For example, they have collaboration with partners in Dubai, and they have a collaboration with partners in Morocco. And we all know those local partners very well, and we were trying to find a way to support them. And we were really glad to see that they would like to collaborate with Sinopharma. So, we could sort of promoting the technical transfer and promoting their collaboration. Although we don't invite directly into SOE like Sinopharma.
Thanks,
you.
Mingwei. And Amar, get a
I was,
minute.
I'll give a quick reaction. Thank you so much, Jennifer. I think this is heartening to see that all the hours and hours of hard work that we've put into breaking down this data carefully, that the trends are actually making sense, because that's the greatest worry for any researcher, is that you put out the data and then you don't know what it means. So we'll definitely make use of your expertise and also read up on your papers to see how we can maybe put the story together. Because I think what I've described today is just touching the tip of the iceberg. There is so much more to it. We want to go deeper into countries and what we are after, and it's reflected in some of the questions I'm seeing in the chat. Is my sense is, in the healthcare delivery value chain, there are pieces where China has done a lot, and there are definite competitive advantages that they have. But then there are others where more other donors have advantages and have done more. So where and when do the pieces fit together? And just as much of the discussion in the global arena is around debt trap diplomacy and South China Sea and all that, I think there is a need to talk a lot more about health, where there is, I think, a lot of opportunity for collaboration, since it's such a quintessentially humanitarian field. So I think our hope is that more researchers will take up our data and use it and try to paint a picture of what China is doing in Africa, because I think it's a story that needs to be told. My one question to you, Jennifer, is, as you were describing the history of those medical teams, you'll see, and I am finding in our data that you'll see project entries which says Hubei province medical team number 16, number 24, number 36, which means year after year after year, they're doing the exact same thing. Sometimes they're parking a ship quite literally off the coast and doing this. So my question is, how did it start? And how is it that a given province chooses to be in a certain province in Africa and then just sticks with it? Is there some system on the back end that is pushing them, and there's a map that we need to cover this, or is this coming out organically, and is this going to continue?
Yeah, that's a great question. There is a system, but I don't know whether we can, I mean, there's a map somewhere, maybe we can find out. But as you can see, the data usually are not directly coming from China, but with some effort, we can see what's happening. But I think that the Chinese medical team are the first established in China ahead of many other forms of activities. And this was initially from the Foreign Affairs, so the sort of the State Department of China. And they receive request from a country, and then they chose, my sense, at least from the document I've seen, is that they choose a province to say, well, this province and this country in Africa can be a friendship partner, and then the province will build this team, and then this team, based on the request, whether there are internal medicine, OBGYNs, so build a team, and then this team will go to the embassy in that country, Chinese embassy in that country, and then the embassy will provide the diplomat and translation. And one fun fact is that they can always bring a chef with the team. So that has been run for a very long time. Yeah, so that's, in a way, because it has such a long history, it's very different from the many other new activities.
Thank you all very much. I know we only have about 10 minutes left, and there's a slew of questions, but I thought I would just read out a few of them briefly and then do one final round. Let's see, Jinwei Ju asked that, says it seems political considerations are inescapable. when it comes to assessment of long-term impacts? Will there be benefit to the citizens of African countries that have leaders who have not enriched their citizens but themselves? In other words, like how does kind of local and national politics in Africa intervene or kind of disrupt some of the potential good that could come from these projects? Another question specifically to Mingwei that is connected asks if how you have dealt at the IFC with corruption when pursuing projects in Africa. And then let me just read a couple more. Chen Le Pan says, while China is leading the overall amount invested in Africa's healthcare, the data seems to suggest that the majority of money is in aid but loans. With healthcare being such a critical infrastructure for every country, are there concerns about sustainability and long-term control of self-determination related to healthcare for governments in African countries? And then let's see, Max K, one of my former students, asks for Jennifer, you mentioned that there was some criticism of Chinese engagement from local actors in the post-BRI period. Can you elaborate on what these criticisms were focused on? And then another question from him, it seems that African actors, can you speak to what it seems African actors hope to gain from Chinese engagement in the healthcare sector? And let me just do one final, let's see. I just wanted to read out Paul Nantulia's question because Jennifer's answered it, but he said that many senior African health professionals noted that Chinese COVID assistance was more focused on clinical interventions and less on what they seem to need, behavior change, preventative health, the health-related risk communications. He's wondering kind of how that kind of COVID engagement kind of played out. So let me leave it there. I apologize to those who submitted questions that we couldn't get through. But again, since we only have a few minutes left, let's do one final round from each of the speakers. And maybe let's go in reverse order. So Mingwei, there were a couple questions directed specifically at you.
I think the question directly to me is only the corruption question. And I mean, especially for FC, that's also I learned, a lot, like a major difference from where I used to work and currently I work for the Global Development Organization. So FC has a really systematic and strict requirement for anti-corruption, especially for projects in Africa. I mean, for example, for the African Medical Equipment Facility, I just introduced doing the appraisal, even before pre-appraisal, we will see whether the company had any negative information or negative news online in both English and Chinese, basically in every language. We have a research team. They would run scrutiny about the company's negative news to see whether they involved in any bribery, corruption, in their tender or in their sales activities. So then when we move to appraisal, we would check their contract they signed between the OEMs and the distributor, and to check about their corruption clause, anti-corruption clause, and also check whether the company has anti-corruption policies in place and how they would like to implement it, especially in Africa. And we would interview their Africa sales team and investment department to see how they could combine those possible corruption activities. So we have a really comprehensive system to avoid this thing happen, especially when we submit our investment package to ask for internal approval from our management team. This kind of governance and anti-corruption piece is a very important component. And we need to answer the questions from the management team at the project meeting to to prove that this company is really clean and it won't hurt FC's reputation.
Thanks, Mingwei. Emma.
So the questions I think are directed toward Jennifer, but I think one thing I want to say about this whole issue of politics and stuff, I think there's no denying the fact that the direction of the money is dictated by a number of factors. And I was, for example, quite surprised when I saw that out of all of the countries getting health money in Africa from China, Angola was number one. And I was like, what's happening in Angola? Why is Angola number one? And then I looked at the data more broadly and realized that Angola is actually one of the topmost recipients across the board. And I think it's because of the resources that that country has, and DRC and others as well. So I think there is definitely, so once there could also be these economies of scale kind of things, where if there is a big presence in a given country in energy or extractive industries, chances are that they would have similarly large interventions in healthcare and other sectors as well. And I think I'll stop here, and then I'll let last few minutes I'll give my time to Jennifer.
Okay, thank you. So I think the question, several questions relates to criticism, and one question relates to evaluation and about loans. So I think they are all actually interconnected because evaluation is an issue. So not unlike the many Western countries or Western donors that look at the specific indicators and has a very sophisticated M&E on many of these projects, monitoring and evaluation. So far, we haven't seen China really using any of these very the evaluation system to their program. That's one of the biggest criticism of China's these activities. And actually, one time I saw one RF, sort of a call for teams to join these activities to go overseas for as a special team. It specifically talked about, you should do more work, and don't just try to publish or so I think it's very different, the mentality. But I think that might change in the future. So that's one of the criticism. Other criticism, especially the local ones, before BRI, before this is really being targeted by Western countries, the criticism were more on, when they donated the device, but there's some lack of a systematic approach to these medical devices. Not many people know how to use these devices over there, lack of training and basically lack of the host pre and post services, even though with these donations. And some of the hospitals may be not very well integrated with the local other infrastructure, so it ended up not being used very well. But those are just mostly local concerns. But I think after BRI, especially in recent years, there's increasing anxiety, I think, from the Western countries to see China's bigger footprint in Africa. So it more becomes part of the great power competition, that including the competition on soft power as well as influence. So when you come from that perspective, then there will be a lot more criticism on China's intention and especially relates to the loan, right? But luckily, I think Amar just mentioned that even though the health assistance is very small proportion of China's overseas development funding, but that part is mostly aid, right? It's not so much loan. So I hope that answered that question. Yeah, so Karen Zhu asked a question about, what are the good examples of multilateral collaboration? I think that's an important one because I do hope, China seems more active with COVID-19 to participate in these CEPIs or WHO initiatives, and maybe that's a start of more collaboration. I would say one successful example is right before, it's right around the Ebola, when China CDC and US CDC have worked together many years after SARS in China, but then they also worked together on the Ebola epidemic. And after that, they built a agreement to build 5 centers in Africa on CDC. So China helped build the infrastructures, and US CDC participate in coordination. That was a good example, but it's very short-lived.
Jennifer, thank you. That was actually the last question that I was going to ask, was about potential collaborations and examples of previous ones. I think that's a really good note to end on. And I think there's a potential, both in terms of what Amar's research shows, as well as what both you and Mingwei talked about, is that there are clearly there's no end to the needs in this sector in Africa. The needs are great, and the numbers of actors who are involved should and obviously can complement one another's activities and possibly even collaborate. This is the kind of research that we need more of, so that we can kind of help policymakers identify these sorts of opportunities. I want to thank all of you, Jennifer, Amar, and Mingwei, for joining us and for sharing your work and your research with us. I want to say a brief word of thanks to our funder, the Henry Luce Foundation, without whom this would not be possible, and for our team at the African Studies Center, Martha, Salima, and Ifan. Thank you very much for your support. And finally, a word of thanks to our co-sponsor today, the US-China Dialogue. We appreciate their co-sponsorship of this event. This is the last event for the semester, but for those of you in the audience, we're going to start afresh again in the fall with some virtual webinars like these that we've been doing, so that our international audiences can join us. But we're hoping as well to host a few in-person events in Washington, DC. So Mingwei, we're looking forward to having you back in the neighborhood. And thank you all again for sharing your Friday afternoons and Friday evenings with us. We look forward to seeing you again in the fall.